Joining us now for more is Key Liu, President and Chief Operating Officer of International Medical Corps. So, Key, how's your group responding to this Ebola outbreak in the DRC, and what are the difficulties that you're actually facing right now?
Thanks for having me, Kyra. I'm very concerned about how and where this Ebola outbreak is occurring. And as you know, the epicenter of the outbreak is occurring in the Democratic Republic of Congo in the northeastern portion. This is an area that borders Uganda and South Sudan. It's an area that is in protracted conflict with over 100 armed combatants fighting for control. It's an area that's densely populated, and the result of which is we have close to 1 million people that are internally displaced. And as you've mentioned previously, it's a rare strain of the Ebola, where we currently do not have an effective vaccine or treatment. All of the above, which makes the risk of transmission and the challenges to responding to this outbreak extremely high. For International Medical Corps, we have responded to multiple outbreaks in the Democratic Republic of Congo since 2018. We had just responded recently in 2025 in the western portion in the Kasai. Now, this area, as I mentioned, of the epicenter is in Ituri in North Kivu province, which is an area where we responded to in 2018. So there are a lot of challenges that we are aware of, and it's starting with the fact that the health infrastructure is extremely weak. I remember visiting and assessing health clinics back in 2018, where many of them did not even have clean water or running water, and clinical staff had to go outside the clinic to bring water back in order to treat patients. So everything that needs to be done in order to contain this crisis, starting with surveillance and detection of isolating suspected and confirmed cases, of being able to build Ebola treatment centers, we're going to be able to need to do.
So if there's no known vaccines to treat this, what do you do?
So we have to revert back to just traditional care and public health measures. So for patients who are in the treatment centers, all we can provide, as I said here, is care and maintenance, make sure they have fluids, they're able to have access to food. But it's the public health measures that are extremely critical. So with the support and in coordination with the Department of State, we are responding. We have rapid response teams in the impacted areas. Our teams right now are in Ituri. They are in North Kivu. They are in Goma. We are in the process of coordinating with the government authorities in order to build treatment centers, to be able to build screening units so that we're able to separate suspected patients and confirmed patients, perhaps with other patients in a hospital. We need to be able to mobilize construction materials. We need to bring in personal protective equipment. We need to be able to increase infection prevention control measures. We need to be able to increase access to clean water. And like I said, all of this has to be done in an active combat zone. So it's going to be an extremely complex response in order to support the government and other international and local actors respond to this outbreak.
Right. Then you have to think about protecting your team members as well. Key Liu, thank you so much.